Oh, hey, Dr. Scott Jensen. I'm here with my esteemed guest, Dr. Scott Jensen from Minnesota. Also, past senator from, was it 2017 through 21?
Correct.
Okay, so thanks for being here with us today. Dr. Scott, so you were also going to run for governor, I understand. Is that correct? Wasn't that?
I did run for governor, Wade. I basically I had made the decision to not run for re-election to the Minnesota Senate in late 2019. My wife had some health issues and we knew she was going to undergo multiple surgeries. And so I announced that I was not going to run for re-election. So I thought that the 10 years of school board work I had done in the 1990s and my term in the Senate for 4 years would suffice to satisfy my political career. And then 5 or 6 months after I announced that I was not going to run for the Senate, the COVID pandemic hit. And I was still in the Senate during that first year of the pandemic, 2020. And I found myself inexorably drawn into the discussion and the debate. And so often I was reminded of the verse from Esther 4:14, for such a time as this. And it felt like that was why I was in the position I was in. I never saw myself as any kind of a big whistleblower or source of controversy. But when I raised my concerns regarding the Minnesota Department of Health and the CDC revising the way death certificates were to be completed, it seemed like all of a sudden my life took on an entirely different trajectory.
So you basically stepped into that role and just followed where your path was, headed, because it was the right thing to do.
Yes, and I think it's important to say that I didn't see myself as any big, courageous Daniel in the lion's den. I didn't at all. I just thought that I was responding to my normal level of skepticism about things. And I am typically skeptical, both about conventional Western medicine and the role big pharma and big government play in our lives. I'd never experienced having big technology with internet and the various social media platforms not liking anything I did or said. So that was entirely brand new. But as that year 2020 unfolded, I was recruited by numerous people to consider running for governor in Minnesota. And it probably took me 6 to 12 months to really say, okay, I'll do it. And I think looking back, if someone had told me what my life would look like 5 years ago, I think I would have been more like Jonah, getting faced with doing some tough work in Nineveh and deciding to skip the Nineveh trip and go to the Mediterranean. But then that whale got in the way. And I sort of feel like that was my life. I am just astonished at how people have come to despise me or appreciate me in many situations without ever having had any kind of a conversation or even an interaction with so many of these people. And yet that's what my life has become. I think I'm a lightning rod for many people. Some despise me, and certainly many people have been very kind and seem to appreciate the fact that I'm trying to speak from the heart and use my experience as a physician in the trenches. I've been a family doctor for 40 years, and I'm not trying to arouse anybody's ire. I'm just expressing the perspective that where I'm at.
Yeah, well said. I think there's a lot to the fact that standing up can look like one thing, right? It can appear as though there's maybe a zealot degree to that. But again, I shared with you off the mic earlier just how much I appreciated your message. And anybody who truly looks at a human being can tell when they're sincere. And that's how your messages come across. There's a genuine concern about using people's minds. Think about what you're seeing, think about what you're listening to, think about what's been said, and look at that behavior as, a big question, what's going on? When you see your history briefly and how things have transpired over 40 years, the level of power, the level of, dare I use the word, extortion or something like that, the level of power that pharma has and influence, and then how this old guard, so to speak, now has so much authority in everyday behavior of human beings, citizens. So what have you seen? Like, when did that take a big turn, or has this been going on all? Now it's just a momentous change over time with your experience.
I appreciate that question, Wade, and I appreciate it for several reasons. First off, I think people need to realize that man has been on this earth for thousands of years. And during that time, someone who was in need of healing would go to a healer. But when they did that, their roles weren't suddenly flipped upside down, whereby all of a sudden the patient would give up their right to making the final decision. It's only really been over the last 80 years that we've seen that kind of the doctors in charge. And for the most part, it's been conventional Western medicine that has fueled and given shape to this model of doctor-patient. It isn't working. It may have worked for a period of time when the pharmaceutical industry was perhaps more connected to being a research and science kind of industry. But when it morphed, and I would say this happened particularly in the 1990s and the early 2000s, when it morphed into this behemoth, powerful sales force that really focused, instead of on providing information to particularly physicians licensed to prescribe, instead it became much more of a sales pitch. I used to have wonderful relationships with multiple pharmaceutical representatives. They would come to my office and they would explain what the first in class drug was like and how it worked, whether it was an ACE inhibitor, whether it was perhaps a sulfonylurea to help diabetics, but a second generation sulfonylurea. These kinds of conversations I would have were incredibly important for me to be able to add some of these medications to the arsenal of what we would do to help patients. But that changed. I could sense it. I used to be extremely accommodating to pharmaceutical representatives that wanted to come into my office and chat with me about a new product that they were representing, detailing. But that stopped. It stopped more than a decade ago because you could feel it. The representatives now were not interested necessarily in answering scientific questions I might have. It was far more about, well, why are you giving me pushback? Just let me leave some samples and you use them. And I think it took the medical profession a little time to adjust to what was happening. Because what was happening was, once a patient was introduced to a megabuck prescription, they didn't want to try anything else, even if there was a vastly less expensive generic drug available. When I look at what I offer patients, I offer education. I might offer surgical procedures, injections, therapies of some sort. But so often what I'm offering is my prescription pad. What medication might help them? Well, literally, we saw pharma rise up with an appetite to convince and persuade physicians, if you aren't doing this, if you aren't doing this, if you aren't doing this, you're not a good doctor. I remember the 1990s, where it was the pharmaceutical industry that pushed physicians hard to add the fifth vital sign, How's your pain level? 1 to 10. How you doing? Because if Dr. Jensen isn't taking your pain from a 6 or an 8 or a 4 down to a 1 or a 2, I'm not doing my job. And don't worry about the addiction potential. We've got this OxyContin, and it won't addict. And it'll take care of your patient's pain. And they can be more productive, satisfied, contented members of society. Powerful, powerful convincing and persuasion that went on. That was the late 1990s. Things were changing. When I look back on it now, I can see it with some clarity. At the time, I was dealing with people that had brought forth insulin products, that had brought forth second generation penicillin drugs that could help us fight back against skin infections, could help us fight back against intestinal infections. We had antiparasitic drugs being put on the market. It was a glorious time. The pharmaceutical industry grew from a fledgling industry to one that really knew how to create new drugs. And then you throw in 1986, where President Ronald Reagan signed off on a bill that removed liability for pharmaceutical companies regarding vaccines. That was a far bigger time and a more momentous time than anybody realized, because at that point in time, vaccination research went from ho-hum to the holy grail. If you could get a new vaccine on the market, you had no liability. If you could get a few key players to go along with it, you were in like Flint. If you could get the American Association of Pediatrics, if you could get the FDA to sign on, if you could get the CDC to sign on, if you could get your new vaccine added to the well-child schedule of vaccinations, you were in like Flint. I have never been an anti-vaxxer. I've been vaccinated against polio, as have my children, and I'm grateful for that. I have never seen a case of diphtheria or tetanus, and I attribute a lot of that to vaccinations. I am grateful that rubella doesn't afflict our pregnant moms around the country and around the world. I gave lectures on the breaking news regarding the potential for a Lyme vaccine. I did all these things. And I saw the vaccination industry become literally a powerhouse of corporate profits. Certainly over the last 3.5 years, we've seen it take on new dimension with an incredible rise in adverse events being reported, but also an incredible maximization of gross revenues that pharmaceutical companies received from creating a vaccine that was monumentally revolutionary, that didn't go through the 4 to 10 years of testing, but instead, in less than a year, it was on the market with incomplete human trials. And we saw Pfizer generate tens and tens of billions of dollars on a product for which they had no liability, and ultimately for a product that did not provide what the pharmaceutical companies had pledged. This is what I've seen. So your original question, Wade, was, did I see it happening in real time? Yes. Late 1990s, first decade of our present millennium. But even there, it snuck up on us. But I think the last 4 years have really awakened an awful lot of people to recognize that something terribly wrong, terribly nefarious has occurred.
Great answer, by the way, very in depth. And the fact that in real time, you're busy taking care of people. You know, you're busy doing what you love and working for your patients. And in the process, this kind of happens, and it's like the boiling the frog syndrome, right? It happens before we know it. So I appreciate your introspection there. Shifting towards a little political piece, you had mentioned how the pharmaceutical companies came in with that type of changing attitude about drugs versus the vaccine industry around 86 with their release and liability. Specifically around drugs, how did that influence with your political experience how the lobbyists come in, for example, cholesterol standards, and the fact that what I see on my end as a clinician, but not in medicine, but in the medical field, see patients coming back with no choice. The doctor doesn't seem to have a choice because it's a standard of care that's dictating that doctor's automated response, so to speak. Can you either re-clarify the inaccuracy of that, or help me understand if that's really what's happening and how that may have changed and what you saw as a politician, if that's not too loaded of a question?
I don't think it's a loaded question at all. I think it's an honest effort to try to uncover and unpack what exactly happened. I think for many physicians, but certainly not enough. And when I say physicians, I'm referring to prescribing physicians. I think it was the statin drugs that really peeled away some of the blinders. We went, I believe, from the first statin, might have been Mevacor, to literally a parade of statin drugs. And it seemed like every time one of these expensive agents became generic, as soon as it was now a generic, less expensive drug, in some way or another, it got kicked under the bus to make room for the latest and greatest trade name drug that, oh, by the way, it's high buck, but your insurance will cover it, but this will really do the job. We had products that literally in 1 year were elevated by all the marketing forces of the pharmaceutical industry. And within a year, it would be now generic, replaced by another expensive, brand new drug. The generic would be demonized as it doesn't do this or doesn't do this. We saw the parade go from Zocor to Lipitor to Crestor. But I think during that time, patients never got a break on the cost. And nobody ever really seemed to come back and revisit that statin drug. I was concerned right around 2010 that things had gone way out of whack. It seemed like the pharmaceutical companies, if they had their druthers, they'd put those statin drugs right in the water supply like fluoride. And I remember in 2013 deciding that I needed to write a book alarming my patients as to what was going on. And so I did. And we published that in 2015. And in it, there's a chapter whereby an elderly patient of mine who had had no heart disease was put on a statin drug, despite the fact that she was in her 80s, despite the fact that she had had an angiogram that showed that her vessels were clean and she did not have any plaque obstruction. I remember calling the cardiologist and saying, "Why did you do this?" And he said, "Well, her cholesterol was a little high." And I said, "She's lived more than 80 years. And you just reported to me that the angiogram shows that her vessels are clean. What do you think the likelihood is that this statin drug is going to provide some benefit in terms of putting off morbidity or mortality or providing a higher quality of life when she's already in her 80s?" And he came back and said, "Well, I guess I thought that if we were going to spend the money to do an angiogram, we could certainly spend the money to put her on a statin drug." And at that point in time, I said, this interaction between my patient, myself, and the cardiologist needs to be recorded. And I put it in a book called Relationship Matters. And that chapter really became a bellwether for so many of my patients. And I think there's other examples as well outside of the statin class. But it still bothers me, Wade, that we know that statin drugs can potentially impact on insulin resistance, thereby causing blood sugars to rise, potentially causing a patient to go from a situation where they did not have the diagnosis of diabetes to now they have diabetes. Literally, we could see a statin drug create a diabetic situation for a given patient. And in that situation, the recommendations from many of the scientific studies were to not stop the statin drug to see if you could go back to where you were, but instead to increase the statin drug, because now that the patient had diabetes, we should try even harder to lower their cholesterol. It was absolutely counterintuitive. Those were the kinds of things that happened that I just said, I've had enough. I never really felt like I was declaring war on Big Pharma. I just felt like I was going to say, you know what? I cannot let my voice be silent. So I wrote this book. And then COVID hit. And I think a lot of what I wrote about in the book Relationship Matters in 2015 was all of a sudden put on steroids, where you could see so many problems with not just big pharma, but with big tech, with big government, with big insurance. All of a sudden, patients really had stopped being their own best champion. Honestly, Wade, it was the chiropractic profession that was at least trying to put on the brakes a little bit and saying, hey, hold it. We honestly believe that the best kind of healthcare results are going to come when a patient feels informed, provides voluntary consent, understands, and recognizes their own responsibility to themselves, that they have to be their own best champion. In conventional Western medicine, many times we were telling the patient, shut up and take the pills. It took COVID to peel off the blinders. And I think if there's a silver lining to the gray cloud of COVID, that's one of them, is that I think that patients feel betrayed. I think they feel abandoned. I think they're looking around. They're asking, who's going to be offering to me the whole menu instead of just giving me in a restaurant half the menu to look at, where I don't get to see things that would come with a holistic approach, an integrated approach. I don't get to see what dry needling or acupuncture or chiropractic or nutritional supplementation, all these things. I don't get to see those. All I get is surgery, needles, or pills. Patients are saying, I've had enough. I'm leaving you. I see that every week.
It is heartbreaking, and I would agree that if there is a silver lining, more people have awakened to. I don't want to say that fact because, but I would say to the awareness that they do feel betrayed. They feel a lack of trust. And I would say it might even just transfer into all fields in the healthcare industry because they feel, I think betrayed is probably the best word.
If we wanted to go into an in-depth analysis of provider behavior, we could use the phrase cognitive dissonance, where cognitively and consciously, we know that this is what we want to be about. But yet, forces perhaps beyond our control are forcing us to do this. And we know in our heart of hearts that this might not be the ideal approach for the patient. So I think there's a disconnect for many physicians that feel like they're almost being pushed to nudge aside some of those axiomatic philosophies they grew up with during their medical training, such as primum non nocere, first do no harm, the Hippocratic Oath. These kinds of juxtapositions of what we learned and what we're now being asked to do, they cause a terrible amount of internal angst for physicians. And I think it's part of the reason that we're seeing a loss of gratefulness and pleasure in being a physician. I think it's caused early retirement. I think in some situations, it's literally caused suicide. Many people don't realize that every year in America, we have several hundred physicians committing suicide every year. One year it was, I think, 400. We had more physicians commit suicide in 1 year in America than might graduate in 1 or 2 medical schools combined.
Yeah, that's a depleting profession, right? with those numbers. There's a couple things you said there that I wanted to go into. One being, first of all, you're still in practice. Is that correct? Or are you retired?
I take Mondays off, so I see patients Tuesday through Friday.
Awesome. Well, you're a boon to your community, so I'm grateful that you're still in practice. They need your wisdom. Are you on your own, or are you with a system yet, based on all the transpiring events that have happened?
About 22 years ago, I started my own clinic. And then about 6 years ago, we built another clinic. So my daughter and I are both family physicians. She runs one clinic, I run the other. We've got offices in Watertown and Chaska, Minnesota. About 5 years ago, we joined a consortium of independently minded clinics. And collectively now we're entitled iHealth, I-Health. And we've got numerous divisions. We've got a primary care division, an orthopedic division, a colorectal surgery division, OBGYN division, cardiac division, vascular division. So we've done that in an effort to, one, maintain independence so that when I refer a patient to a specialist, I'm not beholden to anybody. I can refer that patient to anybody I want, whether they're in iHealth or not. I sleep like a baby at night, Wade, because I hold to the mantra, if I take care of my patients like I would take care of my wife or my children, I know I'll be on firm ground. And so we are in a much larger independent situation, but I believe that it's the autonomy that makes medical providers more satisfied and more content. And I think that's what's caused me to feel so excited at the age of 69. Next couple of months I turn. I'm still excited about taking care of patients. I'm jazzed up by seeing a given patient and doing some research on their behalf and putting together what I consider an ideal plan. I'm no different today than I was 30 years ago.
So are you still classified as a GP?
Yes, I'm a family physician, yes.
Beautiful, because they're so rare. So you're a rare breed. I know that locally here in Madison with our University of Wisconsin hospitals and school, medical society and whatnot, we've worked with them on a number of occasions in a very positive way on some legislative efforts together, which has been great. We worked with multiple professions, podiatric, optometrists, the nursing community. And so we have a good outreach. I've been the co-chair of our legislative work with our association. And my point for stating that is, as I look at the overall physician choices, kind of like what I alluded to a little earlier, you had just clarified or gotten really distinct about it, is the autonomy of the physician allows them to actually have more joy, cutting to the chase, with practice, partly because they feel like they're actually able to decision make in that process, correct? And feel as though their choices are on the behalf of the patient rather than the tier of administrative corporation objectives that seem to be, and again, I'm not in that mode, but that's what I experienced through my patients' feedback, is that it's just a system that is dictated to those physicians rather than you get to have a choice and say, no, out of these 10 options, I like this one for this patient for these contextual reasons. Can you add to that?
I think you're right. I think the autonomy allows us that sense of aligning everything, the patient's agenda and perspective, our agenda and perspective, the findings that we get through the history and the physical exam and the ancillary studies, ultimately coming up with a differential diagnosis, deciding that this is the most likely or clearly is the diagnosis, putting together a treatment plan, putting together a plan whereby we monitor how the treatment's worked out. I think when all of that aligns, there's a certain satisfaction in the human mind. I think many people who are mentally frustrated or mentally anxious, regardless of what work they do, when there's a disconnect, it feels almost like in the brain, something's knocking on the door, wanting to get corrected. I oftentimes tell patients, sometimes it's almost like there's a red flag sticking up in your brain and you need to take care of business to push it back down, flatten it out so it's not there anymore. I think that's really missing in healthcare. I think we've moved into an algorithmic situation. And I think that's one of the fears, even with artificial intelligence, is that we're going to check the boxes and we're going to have some robot or artificial intelligence source spit out the answer. But that's the thing about humans, Wade. We're not easily pigeonholed. One person might describe what they saw from a given corner of an intersection regarding an accident, and it'll be completely different what someone saw from a different corner. Shoot a mile, you might have two people on the same corner describe it completely different. So I think that we really need to understand that there's something joyous about a human. There's something joyful about seeing things line up and knowing that you've done a good thing for another person. We are losing that in the world of healthcare. Patients are feeling that. Physicians may try to ignore it, but at some level, I think physicians are getting internally hostile towards themselves and others. And that hostility manifests itself in a variety of ways. I remember being so ridiculed and demonized in the first part of the pandemic. There were physicians who never met me that wanted me to lose my license. Now, they didn't know me from Adam. They might have known just through the grapevine that I was in the Senate. They might have known that in 2016, I'd been named the Family Physician of the Year in Minnesota for the entire state. They might have known that I was a professor at the medical, and an adjunct professor at the medical school for years. And those things I would have thought might have caused them to cut me some slack, to say, well, this guy really isn't some whack job. He must have a reason for articulating the viewpoints that he's articulating. I remember sometimes seeing someone ridicule me, and I'd reach out and say, hey, do you want to get together for a cup of coffee? Could we just talk? No interest, none. Just vilify and demonize me. This was categorically the thing that shocked me the most about my medical profession during the COVID pandemic. I'm convinced, Wade, that we will not repair the damage done to the medical profession in my lifetime. It's too far gone. I don't think that that's to say that we shouldn't try. I just don't think it's going to happen. We've gone, what do they say? The bridge too far.
With all that said, and the fact that you come from a foundation of doing goodwill to your patient, loving what you do, and believing in medicine, what do you think the idea of a physician, you bringing that concept in the political arena to share with a legislator on how to improve the distribution of health and the access to quality health, how do you think that's would ever, and I want your honest opinion, that would even not be received, or you would be ostracized because it doesn't fit the giant corporate tech we alluded to earlier? Is there any hope?
Well,
fresh logic.
I'm a hope-filled person, so there's always hope. With God as my creator, there's always hope. But I would say this, spending 4 years in the Senate, going in with 35 years of experience, knowing how the healthcare system worked, knowing who got left out of the picture, knowing some of the abuses, knowing some of the shortcomings, and working with senators on both sides of the aisle, and finding senators on both sides of the aisle incredibly close-minded at times, feeling like the subject matter expertise that I brought to the table regarding healthcare didn't measure up to their seniority claim. There is so much in the world of politics that is based on seniority. You can be an absolute knucklehead when it comes to understanding the healthcare picture. And if you're in a position of seniority, you can absolutely squash outstanding ideas that may well be born from a bipartisan perspective. So in terms of, was I impressed with what we did in the Senate in 4 years? No, I think at times it was disgusting. There were challenges to be faced. We didn't face them because the conversations might have been politically vexing during the next campaign cycle. So how do we do this? I think at the end of the day, I think we have to lean into the greatest resource America has, and that's faith in something better than us, bigger than us, divine. And I think the second best resource we have is the people. So if the people will recognize that we have greatness within us, but it doesn't come automatic, it doesn't emerge easily. It's there because we've been created by a great God, a great creator. Whatever you characterize that God as, that's cool. But that's how we get through this, is recognize and have faith in something better than us, and recognize that intrinsically we have greatness. We can do remarkable, marvelous things. We can show love in a humanitarian way that we might never have thought we could, but we can do that. But we're not going to do it if we're stuck in a divisive political system that pledges its allegiance to a seniority-based system. It's bleak future, but I refuse to give up, and I refuse to not have hope.
Yeah, thank you. I'm with you too on the hopeful part, and I don't just blind hope, but I mean the process of how human beings have overcome adversity in the past, and the fact that people are waking up on a daily basis and increasing. When you try to deliver a message, like I alluded to yours earlier, where you respect the listener, and that's how you communicate. Whether you know you do that, by the way, you automatically command respect to your listener, and that is how you deliver, which means they can receive the message. So for those who can't, they're already locked into a judgment, and sadly, where that puts them in the grand scheme as an obstacle is here nor there. But for human beings that want leadership, and they're looking into now, they thought they had leadership in their medical system and with their health, and now they're realizing, hey, there isn't the leadership, that it appears bought and sold. Do you feel like we as a country are already bought and sold? Because the behaviors that are showing up, the actions that are being taken, make no sense. You've alluded to in many ways.
Wade, when I ran for governor, one of the things I was impressed with and had not anticipated was the number of people that seemed willing to step off the sidelines and get in the arena of engagement. I'm absolutely convinced that Americans do that. They're willing to do that. It may not be their first priority, but there might be 2 or 3 metrics that we could look at right now that can provide assurance. One, recent Kaiser Family Foundation poll revealed that 34% of Americans believe that the COVID vaccine is responsible in many situations for inflicting medical problems or death. That's not some small subset of conspiracy theorists that you can kick under the bus. This is 1 out of 3 Americans. Let's go with the second metric. I believe that only 18% of Americans have taken the full array of COVID vaccines that they would be scheduled or eligible for. Only 18%. 82% have not. Many of them might have taken the first J&J. They might have taken the first series. They might have taken a booster. They might have taken a booster. But in terms of taking the 6 or 7 injections that you were eligible for, they're not doing it. And it's shrinking. And it's not because they are anti-vaxxers. That's just calling them names. And that's not fair. It's because they're paying attention. And they're saying, hey, I took the first 2 and 2 more because I was told that I wouldn't transmit the disease and I wouldn't get the disease and I wouldn't threaten grandma's life. But grandma's dead, and it wasn't because of me. And I got COVID despite the fact that I 4 vaccines. And that 4th vaccine really knocked me for a loop, and I had palpitations and still have some atypical symptoms that I just as soon not have. Those are a couple of pieces of information that tell us Americans are thinking. We have people recognizing the fact that while wearing a mask might provide some measure of filtration of particulate matter that we're talking about, 0.1 micron in a viral particle, it might filter 10 to 15 to 20%. But if you've got 80% passing through the pores of a mask, and you don't need anywhere near that amount to, if you will, get infected, people are recognizing that that's not cutting it. People are recognizing that asymptomatic transmission isn't the, if you will, catalyst that we were told it was for the super spreading of the disease. They're recognizing that while we don't have all the science in yet, asymptomatic transmission is not the 50% responsible character. In some studies, it's 7%. Some studies, it's 2%. But whatever, it isn't what it was made out to be. People are thinking, people are engaging. And if there's one thing I would say, it's people are getting in the arena. And in that arena, they're willing to get bruised and bloodied and speak their piece. I honestly think that's what's going to get us through this whole thing.
Yeah, that's great. And I hope you're right, from the fact that people standing up and saying no by this tyrannical type behavior by our government is also breeding distrust, even more so in that body, that governing body. So I find, sadly, many of my patients have had many different responses from the vaccines, which I can't ethically state that was it, because there's no true way of proving it. But inherently, they seem to know. And secondly, it's still my role to find out information as to what role that played in their new recent health picture, to gain access to how do we take care of this cytokine storm? How do I support you in an area where they're going to deny it if you go back to them, so to speak, versus now I can send them possibly to Dr. Pierre Corey, who also had to break out on his own for some great medical attention locally. I say that because the frustration is the same thing. I'm not anti-vax. I've never been. I'm pro-information and pro-consent. It is ultimately the person I'm talking with as to the choices they make. And they have to have that, in my opinion, that decision-making process theirs. And it hasn't been, as you know. So this big uncovering state that we're in, as uncomfortable as it is, and disheartening and stressful and damaging, destructive, it's moving us to, in my opinion, a better place as long as we stay conscious, aware, and on our toes.
I agree, Wade. And that's, again, why initially I wrote the book in 2015, Relationship Matters. I wanted people to use real life patient stories that I took care of to understand what was happening to the healthcare system. And then 2 years ago, I wrote another book called We've Been Played. And that explores that triad of tyranny of big pharma, big tech, and big government. Because I think that when those three juggernauts come together, it's very, very difficult to oppose them. And yet we need to be able to do that. So if you don't mind my sharing with the audience, if people want to read those books and sort of feel like they've been given the information they need, both of the books are written in the same format of sharing a doctor-patient real-life interaction that explores, why do you get a surprise bill? Why did you think you were admitted to the hospital for those 2 days, but you found out you were only in some other kind of care? Perhaps you were just in observation care and you got a big bill that you thought you wouldn't get. Why did your doctor put you on this pill? Why did your doctor say you had to stop this pill that was been working fine, but you're on this one? What do PBMs do to the formulary? How do they work with insurance companies? So either book, Relationship Matters or We've Been Played, can be get it. You can obtain it at drscottjensenbook.com, DRSCOTTJENSEN.com for about $20. And I think it'll give you the ammunition and the basis whereby you'll feel confident saying, yeah, what I've been feeling in my gut, what I've been thinking about in my brain, I'm not some conspiracy theorist hanging around on the 5-yard line where there's nobody else reasonable living. I'm a reasonable, thoughtful person that has millions and millions of other people thinking just like me.
Right. And maybe a lot more questions and answers, right?
Amen.
Right. So no, I'm happy to help promote your book. I will put links in the show notes as well when we're done, so they will have access. And I love that you mentioned those and where to find them. So not only am I grateful for your time, but your insight and your sincerity. And I greatly appreciate the work you do and what you represent, and that there's hope for people in medicine, literally, that they can start to redirect how they navigate. And they're going to have to make choices. And sometimes they're not easy because of financial insurance plans like we see here. But the fact that when they step out and start working for themselves, they tend to reap benefits, right? Obviously, because they're getting more information that is less agendized. Maybe that's the best way I can say it. So
I think that's well said, Wade. You know, we might think that if you're on the ocean or in the woods and you were trying to navigate a path, that the compass would always be there for you. But even the compass, if it's around other minerals that have certain qualities, the compass can get gummed up. And I think that's what people are recognizing today, is what we thought was our compass to help us navigate, that we thought was foolproof. Maybe we thought government, pharma, doctors, media, insurance company. Maybe we thought that collectively they were our compass and they would never fail us. What we're learning is we have to lean into our own gut, our own intuition. We might have to look up at the sky and see the way the stars and the moon line up. And we might have to try to pick out a star, maybe the North Star, and we follow that. But if we're going to look for the North Star in the world of healthcare, it's probably in our own head. It's certainly not in the head of another.
Well said. I love that example. Maybe we should take that as your parting thought, unless you have one.
No, I think you hit it right on the nose when you talked about patients are looking for a way to navigate. I agree with you.
One last question as a favor. We are, as a CSW of Chiropractic Society Wisconsin, are hosting with Senator Ron Johnson this next year a form of roundtable to bring to the public. Would you like to, given the dates and everything working out, would you consider being one of our speakers or presenters at that conference if and when it works out in your schedule?
Absolutely, I would. I've gotten a chance to know Senator Ron Johnson, and I don't know if your audience follows him, but he has been an absolute champion for the everyday American. He has pushed in the U.S. Senate to have hearings to expose some of the fibs, some of the half-truths, some of the falsehoods, some of the disinformation. He's been tireless, and I have an immense respect for the work Senator Johnson does. So if you're inviting me to stand next to Senator Ron Johnson and share my perspective and answer questions, it would be my privilege.
All right. Well, I or someone else in our association will probably me if possible. We'll be reaching back out to you for that with some details when we have them. So I greatly appreciate it. What a pleasure. Thanks so much, Dr. Scott. I think you're everything you're cracked up to be. And I say that with the utmost respect. So it was my pleasure having this time with you. And I look forward to actually meeting in person.
Thank you, sir.
So thank you. And we will have all your information in the show notes. I'm going to actually